Sean Robinson, the CEO of the Mental Health Foundation, said we need to concentrate on keeping people well. What is missing, he said, here is strong leadership and a clear direction. Mental health is like a ship without a rudder that's also running out of gas. While men and Maori don't come out of Crawshaw's annual report in a good light, let's look first at Maori. And as I said earlier, a headline highlighted Maori and mental health and said Maori were more likely subject to mental health treatment, placed in seclusion. In fact, Maori are almost 5 times more likely to be secluded in an adult inpatient facility than non-Maori, and that's a figure which is increasing at worrying rates. Maori are overrepresented in mental health services, are 3.6 times more likely to be put under a compulsory treatment order, and say they are often baffled by why they are under the Mental Health Act, an act they seem to struggle to be released from. More Maori mental health service users committed suicide than Pacific peoples. This is according to John Crawshaw's annual report on mental health. And the suicide rate for non-service users among Maori was higher than among non-Maori. It's interesting that the figures are based on the 2014 year. That's now 3 years old. Of equal concern is that Maori hold the dubious statistic of the highest proportion of people subject to a special patient order. Half of special patient orders are reportedly Maori. As I said, men are also overrepresented in mental health statistics. Also 3 times more men, almost 3 times more men than women died by suicide in 2014. Among mental health service users, the figures were almost 70% for men and 32% for women. But surprisingly, there are no insights drawn by Crawshaw as to why more men die by suicide. Throughout Crawshaw's report, these insights don't exist. It's like he's writing from a bureaucratic bubble, resulting in his report not being touched by what life is like for Kiwis at the coalface. The fact that this report is already 12 months out of date at the time of its release, and the release was last week, has serious and worrying outcomes. The report helps perpetuate the former government's desire to play down suicide, so Crawshaw continues to promote the line that I read so often, and that line says around 500 New Zealanders die by suicide every year. In his report, which is the 2016 year, the actual figure is 510, with a further 22 deaths described as of undetermined intent. Apparently that means a coroner couldn't find enough information to be convinced of how the person died, thereby lowering the suicide totals even further. Those in mental health and our wider community know from media headlines that 606 people died from suicide this year, the year of 2017. That's over 100 more than are reported in John Crawshaw's annual report of mental health. So more and more people know that the total number of people committing suicide, dying by suicide, is grossly understated. Several mental health advocates are saying suicides in New Zealand are closer to 1,000 than even the bigger figure of 600. And we heard that estimate from Maria Bradshaw, the CEO of Casper, on this show a couple of weeks ago. We all know there has been a controversy over New Zealand's draft suicide prevention strategy too. Mike King resigned, the then government refused to set a target by which we could work towards suicide reduction, and generally the draft plan has been described as wishy-washy, without firm goals or understandable policies. And I read that draft suicide prevention strategy. I was singularly unimpressed with its content, and it just seemed to have nothing firm to grab onto. I'm afraid to say that Crawshaw's annual report has the same feel about it. Wishy-washy, packed with bureaucratic speak, which bewilders and confuses even somebody like myself who has worked in mental health for 10 years. I'm very confused by some of the statements. Take the issue of seclusion. I mean, seclusion is a polite word in mental health for solitary confinement. And when I talked to a friend of mine this morning about seclusion, he said he had worked in prisons in Taranaki, and he used the term solitary confinement, and he repeated to me just how damaging solitary confinement or seclusion can be. Crawshaw trumpets a decline in seclusion since 2009. However, he adds that most services that use seclusion are now, and I quote, entering a replanning phase in which they are refining and refocusing seclusion reduction initiatives. What exactly that statement means, I have no idea. This language is yet another example in this report of unclear and verbose description. What does the statement mean? Especially in the light of there being a 6% increase in the number of people secluded between 2015 and 2016. Nowhere in the headlines of this report does it say that there's been a 6% increase in the number of people secluded. That's actually 60 people. 60 people who have been secluded in addition to the normal total. So despite all the spin about seclusion being in reduction, smaller numbers being secluded, there were in fact 1,500 seclusion events in 2016. Now, John Crawshaw uses that description of seclusion events. To me, that's 1,500 too many, especially when young people under the age of 19 are involved. More than 100 young people aged under 19 were secluded in 2016 in 323 seclusion episodes. Well, how scary would it be to be locked away in a room on your own with nothing to do, no facilities, probably no windows, I'm unsure, but probably not even a toilet? The most common age group that was secluded were between 20 to 24. That's very, very young to be put into solitary confinement, in what I would describe as a frightening experience of isolation. All this seclusion seems quite a few when the total number of people accommodated in adult mental health services was about 7,500 in 2016. So we have about 1,500 seclusion events among 7,500 people that were accommodated in adult mental health services. Across all inpatient services, including inpatient, that's acute, psychiatric, forensic, intellectual disability and also youth services, there were almost 1,000 patients who experienced at least one episode of seclusion.
You're with Take It From Us on 104.6 Planet FM.
In New Zealand, we have been promised the reinstatement of the Mental Health Commission and a commissioner, and there's a lot of talk about a review of the mental health system after a great deal of criticism, a great deal of mental health advocates, senior authorities, leading practitioners in mental health demanding a review of the mental health system. But let's carry on our critique. And I'd like to turn to another feature which I must say amuses me about John Crawshaw's report. Surprisingly, great chunks of this report are repeated word for word from the previous year. And this applies to Maori mental health. And despite Maori being overrepresented, as we said, quite significantly in mental health services, the Director of Mental Health uses exactly the same words in his latest report, which is 2016, as he did in 2015. Let me give you an example. He says in both reports, both 2015 and 2016, he says reducing the disparity of Maori mental health outcomes continues to be a priority for the Ministry of Health. Publishing data on the rate of Maori subject to compulsory treatment is just one aspect of what needs to be a wider conversation around Maori overrepresentation in compulsory treatment and assessment under the Mental Health Act. They're the same words, same sentiments expressed the same way in 2 different years. That doesn't provide me with confidence about the Ministry's commitment to do much. He talks about it being a priority, but how big a priority do you think it is when the words are repeated year on year? I've also already read a paragraph from the Ford. He carries on in the Ford, this is John Crawshaw, he says, resonating with last year's theme, mental health care in New Zealand continues on its transformational journey. The government recognises that good mental health improves our lives and has widespread social and economic benefits. The mental health system will acknowledge the benefits of early intervention and allow us to effectively support, nurture and encourage healthy development. To align with this approach, the key themes for our work in 2016 were interagency relationships and early intervention. We used cross-agency data sets to inform policy development and focused on targeting identified vulnerable groups with high risk of poor outcomes, including people with mental health or addiction problems. Well, a lot of big words, a lot of language that doesn't convince me that this is a nitty-gritty, committed drive and campaign to bring quality care through our specialist mental health services. Another fascinating claim by John Crawshaw is that consumer satisfaction with mental health and addiction services was rated around 80% in 2016. Now that leads me to believe that 8 out of every 10 people that used specialist mental health services was satisfied with them. Given the outcry about mental health services being in crisis over the past 18 months, this claim that 80% are satisfied with their mental health or addiction service seems hardly believable. When we drill down into the report, and the 80% satisfaction claim is based on, we find that the 80% satisfaction claim is based on flimsy statistics. About 170,000 used specialist mental health and addiction services in 2016. The survey, which gives this figure of an 80% satisfaction rate, was on a paper-based survey where only 10 DHBs participated and there were only 1,317 valid responses to the satisfaction survey. That's less than 1% of people using mental health and addiction services. Hardly an authoritative poll to claim an 80% satisfaction from people with lived experience. In fact, in my view, my personal view, it's an insult to users of such services and those who are struggling to find help, whether it's crisis support or general support. In terms of this satisfaction claim, the Ministry is now using a new calendar year-based system where 15 DHBs participate. In my understanding, there are about 21 or 22 DHBs. So that's resulted in 2016 in about 6,600 responses. Well, that figure is less than 4%. Just 4% of the 170,000 users of specialist mental health services. I asked the question, why are more people not filling out the satisfaction survey and providing responses? How can the government or the ministry or John Crawshaw claim an 80% satisfaction in specialist mental health services? These figures on which the satisfaction survey are based are hardly statistically significant on which to make a claim that 80% of consumers are satisfied with their care. Nowhere does this report acknowledge the contemporary issues facing so many who have mental health and addiction experience. And I've listed some of those, like living on a benefit, paying escalating rents, the availability of synthetic and recreational drugs. I was talking to somebody at work the other day, and she was saying she's perfectly aware of a tinny house close to a marae in South Auckland where people with lived experience are getting their cannabis supplies. So, you know, if you're living on a benefit, you're living in a mental health residential home, you're not working, you've got limited money, well, what would your option be? The tinny house across the road in South Auckland? What about the waiting times to get care and crisis help? The cost of food, the rising cost of living, the impact of psychiatric drugs and the side effects and the hopelessness of living in communities where there's limited work and discrimination against mental health.
You're with Take It From Us on 104.6 Planet FM.
Wrap up my comments, and these are very much my personal views. The quality of this annual report is long overdue for an overhaul in order to represent the crisis which is prevailing in mental health and addiction services. The CEO of the Mental Health Foundation, Sean Robinson, in response to this release of this annual report, said, "We need to concentrate on keeping people well. What is missing here is strong leadership and a clear direction. Mental health is like a ship without a rudder that's also running out of gas." Now, that comment from the CEO of the Mental Health Foundation is refreshing. It's great that we've got a CEO of a reputable mental health organisation who is showing strong leadership himself. He has his own personal experience. He speaks from personal experience. And when he says mental health, the mental health system is like a ship without a rudder that's also running out of gas, well, I put a great deal of credence and importance on that. Well, I'm out of gas myself with this analysis. Hope you found it helpful. You can access the report on the internet by typing in Annual Report of Director of Mental Health.
Respect